The Z-track method, a type of intramuscular injection, is used when medication should not leak into subcutaneous tissues, when total intramuscular absorption of the medication is required, or when the medication would discolor the tissue. Medications administered by this method include Vistaril, iron dextran, gamma globulin, antibiotics, narcotics, estrogen and testosterone, and procaine. Materials required for this procedure are gloves, alcohol wipes, a tuberculin syringe with needle, 22 gauge and 1.5 to 2 inches long, though the needle gauge may be larger, that is, a smaller number, if the medication is viscous, the vial of medication, bandage strips, sharps container, and the patient chart. After identifying the patient and introducing yourself, wash your hands and put gloves on. Select the appropriate intramuscular site. The dorsogluteal site is preferred for the Z-track method, although the ventral gluteal and vastus lateralis sites may also be used. Cleanse the skin with an alcohol wipe and allow it to thoroughly air dry. Check the medication a third time against the physician's order. Remember, the first 2 checks would have been made when you retrieve the medication from storage. Cleanse the top of the medication vial with an alcohol wipe and allow it to air dry. Following standard procedures, draw up the correct dosage from the vial. Inspect the syringe for air bubbles, tap to release and re-inject them if necessary, then withdraw more medication if needed. Remove the needle from the vial. For a Z-track injection, draw an additional 0.2 to 0.4 milliliters of air along with the medication. The additional air will allow the medication to fully clear the needle and enter the muscle tissue. With your non-dominant hand, pull the skin laterally toward the side opposite the site. Quickly but lightly thrust the needle into the site at a 90-degree angle. Continue holding the skin away from the needle site and inject the medication. Wait for 10 seconds. After 10 seconds, quickly withdraw the needle and allow the skin to track back over the original injection site. This allows the subcutaneous tissue to cover the muscular injection site. Blot the area gently with an alcohol wipe. Discard the syringe into the sharps container. Apply a bandage strip to protect the patient's clothing. Do not massage the injection site. Remove your gloves and wash your hands. Document the procedure. Include the date, time, medication, site, route, and amount administered. Follow office policy for recording the medication expiration date and lot number.